The next is going to be a chiropractic care of a rock climber's shoulder, a case report. Actually, this is my son, and my son's complaining continually. He's a 27-year-old male rock climber. He's just really, if you look at this picture, this is like low. He's climbing these huge things up, and I'm at the bottom of it watching him climb. I went, oh, and everyone's saying, how can you handle that? Because he's my son. I said, he's just, hopefully he won't land too hard. But anyway, and sometimes when you climb up, they have this things where you top out. And so the top out's like at 20 or 30 feet up, and then you're climbing another 60 feet up to the top of it, and it's like, and there's no ropes or anything when you're doing this bouldering. And he's doing this indoors and outdoors, and he's doing very high level climbs, of challenging. So he started having pain in his shoulders that was limiting his ability to climb, and it gradually was going on for 6 to 9 months, and he doesn't just have pain and then say, hi, Dad, how you doing? Or, it's, Dad, my shoulder, Dad. And he said, so he's tried resting, he tried to do nothing. I gave him different anti-inflammatory, natural anti-inflammatories. He took some Advil. He was doing different kinds of things. He started doing exercises. He was going online, seeing all these types of exercises you can do for the shoulder. He was trying to do anything and everything. He had friends who were part of in physical therapy who were familiar with rock climbing. He tried to do all those types of things, and they weren't helping. And finally said, can you help me? I said, I can't climb. It's driving me crazy. So I started to assess him. I noticed his shoulders were forward, and I know I should be treating him more than I do, but he clearly had the forward head posture associated with this sort of movement. I started noticing that when I would test his arm, just when he was on his back, he had no strength, and he's a really strong kid, and he couldn't even hold it straight up when I would try to bring it down towards his feet. And then I found that when I'd apply pressure on his humeral head, he had full strength, and I couldn't even move it. I'd let go of the pressure, and he couldn't hold it up at all. So I know there's a relationship between the shoulder, the cervical spine, and that it has an effect on thoracic outlet issues. And we know there's this kinematic relationship between the head and neck and how they all intertwine. We know there is that type of thing, but how we engage it and treat it is differently. So one of the things, how I treated him, one of the things I would do, I'd assess him. I would then do an adjustment. I'd just adjust it from P to A. I'd go back and do it, and it was pretty wild that just doing that one adjustment, I'd go back and test it, it would be super strong. And his only comment was, oh yeah, how long is that going to last? So, because he said, I want to climb. Because he'd do it, I'd do it, he'd be nice and strong, he'd go climb, it'd be out again. So there was an instability going on there. So what I started to figure was, we had to work with his anterior forward head carriage. And he does have some TMJ stuff, but not really that much. So one of the methods of what I was doing was I put the blocks under his shoulders in this position, and I would apply pressure, releasing the fascia from top down to try to towards his thoracic apex, to try to release the shoulder and the muscles so that there isn't this forward pull, which happens a lot with the rock climbers. I then took the sternal roll and ran it across right at the apex of his thoracic curve, and I would do work on his cervical spine, because as soon as you do that to someone like this, their head will tilt back and they'll go into that position. So I had to work with that the posterior fascial line and the anterior fascial line. And so I worked all along with the occipit to try to make sure that when he could bring his head, that he could then swallow. So I had to release a lot of the area of the tongue, suprahyoid, infrahyoid, all along the muscles, the scalene muscles, while he's in this position and working with the cranium. So I would do craniofascial release, doing all kinds of things to release all this area into the platysma, and just trying to release all that area. And while I would do that, he'd start to being able to stand up straighter, and he'd feel much better. While I was in that position, because it wouldn't hold, I then started using this tape, and there's a company called KT tape. They came out with this Kinesiotape that is in 4 parts, which is really interesting, because what happens is I can apply the tape at this area without any stretch, then I stretch it back over while I'm holding his shoulder back into the position I want it. and then put the rest of the tape there. Once I have that in position, I then pull the sides, which form a nice tension right into that shoulder. As soon as I did that, he said, "Ah," and he could move his arms in different positions, no pain at all. I tested it, it was fine. The next morning, because he slept over, he said, "Dad's first night I could sleep. I didn't have to worry about my arm position," because he would put his arm in positions and he would wake up from the pain. He could sleep however it was. So following the initial office visit in my house, the patient reported having improved strength and sleep without pain in various shoulder positions. The patient was treated in this manner 2 times a week. I treated him twice. He would have been over every single day, but I had the other things I needed to do. I did it for about 2 times a week for 2 weeks, then once a week for 2 weeks. And about a month, 3 to 4 months later, 3 to 4 weeks later, he said, "Do you think I could start climbing?" And it was starting to test solid with the tape on and with the tape off at that point. And he was able to move and function without it. But I said, "Well, let's tape it up and then have you try climbing at a low level." So he was climbing at like V8, V9, V10, these types of climbs. And so I had him start at the V1, V2 climbs, which are nothing for him. And so he began to gradually increase over 3 to 4 months. He was already, by the second week, he was at V5, V6, and I like to rock climb. I'm trying to, and if I can climb a V2 or V3, it's like the greatest thing in the world. And for him, a V4 or 5 is like nothing, and it's just amazing. But he was able to get back up to that, and he's now climbing at a whole different level, back at the level he was before. I haven't had to tape the shoulder up in months. He found that when it was taped, he could climb at higher levels of difficulty with less pain and maintain better shoulder function. In addition, he found that his shoulder pain had decreased and he had increased strength with activities of daily living. The patient noted that using the kinesiotape following his treatment helped to stabilize the shoulder so that it wouldn't continually go in and out and in and out. It would stay in position with full ranges of motion and with stressing it, because it was with a lot of the rock climbing positioning involved. You'll look at if you get a rock climbing gym, and a lot of the elite climbers, a lot of them have that position because that's the muscles they're using a lot. They really have to work with trying to develop strength in the other direction. The case study presents a patient with gradual onset chronic shoulder weakness and pain secondary to rock climbing. Chiropractic involved using wedges under the shoulders in the prone position and supine sternal roll into that area to try to help reduce that thoracic kyphosis, with deep myofascial work into the cervicothoracic area and cervicocranial area. Did adjusting of the shoulder and kinesiotaping, as well as gave him some exercises to do to stretch his pectorals, as well as to work with making sure when he's using his arms to try to keep his latissimus muscles engaged and his shoulder blades down. Further research is indicated to determine if other patients with these similar presentations might be helped with a conservative method of chiropractic care. Thank you very much. Thank you very much. Now, I'd like all the people who presented to come up. I'd like to ask